Good morning, everyone, and thank you for joining us for December's edition of Health Bytes with Region 3. We are pleased to welcome this month's speaker, Brandy Klug. Brandy is the Clinical Library Manager for Gibson D. Lewis Library at the UNT Health Sciences Center in Fort Worth, Texas. Brandy oversees a team of 3 full-time staff from Gibson D. Lewis Library who provide library services for JPS Health Network as part of an agreement between the 2 institutions. The team coordinates with hospital staff and clinics to support research, quality improvement, and patient care through literature searching and rounding services. Prior to her work in a clinical setting, Brandy held positions in technical service areas, including web development, electronic resources, cataloging, and acquisitions. She's very passionate about research and education, game-based learning, web design, instructional design, and usability testing. In today's Health Bytes, sorry guys. In today's Health Bytes, our speaker will give an overview presentation of their NNLM Region 3 grant-funded project, Powering Clinics and Communities with PubMed, Building Library Awareness at a Safety Net Hospital System. Thank you for being our guest speaker this morning, and I'm going to turn everything over to you now, Brandy.
All right. Thank you so much, Margie. I really appreciate it. And good morning, everyone. Thanks so much for attending this session. As Margie mentioned, this is NNLM Region 3, a grant-funded project overview for our project, Powering Clinics and Communities with PubMed, Building Library Awareness at a Safety Net Hospital System. And again, I am Brandy Klug. I am an Associate Director and Clinical Library Manager for Gibson D. Lewis Library at the UNT Health Science Center in Fort Worth. And this grant proposal for this project was submitted in February of 2023, and the project was completed in spring of 2024. So our agenda for today's session, we'll start with a brief overview and then move on to some steps for developing an NNLM grant project. And we'll be focusing on these 4 parts here: assessing needs, identifying potential funding, crafting the grant proposal, and implementing the project. And I'll also share some of our project successes as well as areas for growth that we identified. And of course, I'm happy to take any questions you all have at the end as well. So just a brief introduction to our team. As Margie mentioned, we are a group of 4 library professionals from Gibson D. Lewis Library at the UNT Health Science Center. And we provide and manage JPS Health Network library services as part of a collaborative agreement between the university and JPS Health Network. So it's a unique arrangement. It's a wonderful one that we all enjoy very much. And we work as part of the amazing JPS Academic Affairs team to support education, research, and patient care missions of the network's clinics and hospital. So by sharing an overview of our grant project, I hope that you'll discover some ideas and also be inspired to consider developing a grant-funded project of your own. All right, so let's go ahead and get started. So if you are thinking about submitting a grant proposal, a great place to start is by assessing needs in your organization. So depending on the time you have available, this process can be done either formally or informally. And we're going to look at assessing needs as a 2-phase process. So the first phase is going to be gathering information, and the second phase is going to be analyzing our findings. And for gathering information, a great place to start is by asking library staff, is there a need within our library, organization, or community that may benefit from a grant-supported project. And if you are a library staff of one, and I know there may be some folks out there who are, you can also start by asking yourself this question. Another helpful question to think about is, are there any recent projects we have completed that could be showcased or enhanced by a grant? So reviewing statistical data is also helpful in the gathering information phase. And there are a few samples here from our annual statistics that we will take a look at and use for some examples today. So starting with our education participant data, which was 335 participants, we might decide after looking at a breakdown of the participants that we want to increase education participation among a particular segment of the community. For the next example, we had over 22,000 annual library visits, which is a lot. But we may want to think about how we can increase visits among a particular community group if we notice some groups come in less frequently than others, for example. And lastly, we had over 29,000 website visits. But after looking through our website analytics, we might decide that we want to increase traffic to either a particular web page or section of our website in order to better inform the community about certain services, resources, or programs that we offer. So by reviewing your statistical data, this can be an excellent starting point for identifying potential service gaps. And the numbers that you see here are just a few examples of how you might look at this data and use it as a way to inspire potential projects. So from reviewing our statistical data, we decided to pursue a grant project to create outreach materials to help connect with the incredible clinicians, nurses, and staff who work in the offsite clinics in order to increase library awareness among these groups. And while in the gathering information phase, another suggestion is to think about asking your community what type of project would be beneficial. And this can be very helpful for identifying service gaps and potential opportunities for connection. So there's so many ways that you can do this. You can make comment cards and suggestion cards available. You can solicit feedback through social media, administer surveys, and also hold informal focus groups. You might even consider something like holding a contest to solicit input as well. Those can be a lot of fun, and they often generate some really creative ideas. And if you are short on time, and we all know there's never enough time, right? So if you are short on time during this process, you can also look back at past comments, feedback, and frequently asked questions that you've received. So it's great to start with big ideas and big plans, but sometimes we do need to narrow things down a bit just to keep everything practical. And when assessing needs, it is helpful to remind ourselves of the missions of our library and institution, as well as any institutional or organizational values. And this will help ensure that we stay on course and keep project ideas in alignment with those missions and values. So now that we have gathered some information and data, let's look at how we can analyze our findings. And a great place to start is by discussing ideas with your team and deciding which idea is going to be the most realistic to accomplish within the time frame provided. And there are some questions to help guide these discussions that we can look at. So these questions have been grouped into two categories, which are narrowing the need and considering the practical. So let's start with narrowing the need. There are some questions we can ask to narrow down the information that we gathered. And we're going to be looking at this through need, audience, focus, and outcome. So with need, we can ask, what are potential needs that were identified? And what information do we have to support these needs? With audience, we can ask, who is the intended audience and how will they benefit? With focus, we can ask, what do we focus on and how are we going to focus on it? And with outcome, we can ask, what are our goals and what do we hope to achieve with this grant? So next, let's look at considering the practical. There are some practical questions that we can ask ourselves pertaining to staff, external partners, internal partners, and schedule in order to ensure that the project is going to be doable. So with staff, we can ask, who will be doing the work? Can this project be managed with current staff workloads? And what happens if there are staffing changes? With external partners, we can ask, who are the potential vendors and partners for different needs like printing and artwork, for example? Thinking about internal partners, we can ask, who are the potential internal partners that we need to reach out to? And this might include groups like marketing, communications, the Office for Research, like for our IRB concerns, for example, and also IT. And lastly, looking at schedule, we can ask, can the work be completed within the grant cycle? So it is helpful to keep that grant timeframe in mind so that you know what is possible for you and your staff to accomplish within that time. All right, so now that you have gone through a needs assessment, let's take a brief look at identifying the potential funding sources that are available from NNLM Region 3. So if you haven't already, you can start by visiting the NNLM funding page at nnlm.gov/funding and look over the different types of award opportunities as well as the amounts. Finding the right fit for your project is important, so carefully consider which category the project best fits in. The types of awards include exhibit awards, Express Health Information Outreach Awards, and the Health Information Outreach Awards. And it can be very tempting to apply for the awards with the highest amounts. But again, it is important to consider what your team can feasibly accomplish in the amount of time. So thinking about which category our project best fit in, we ultimately decided to apply for an $8,000 Express Outreach grant, and this turned out to be a great fit for our project. Now that you've assessed needs and identified project funding, the next step is going to be crafting the grant proposal. So in this section, we're going to dig into the different parts of the grant proposal process and look at some helpful tips and questions to consider while going through this process. So before we start looking at the different parts of the grant proposal, definitely want to recommend that you reach out to colleagues who have been through the process before in order to get tips and advice. Colleagues are an excellent source for information. We were very fortunate to have some staff in-house at the time at Lewis Library who were experts in the process, which was very helpful for us. Also, please reach out to the incredible folks at NNLM Region 3. The help and support that we received from them before and during the grant process was amazing. So now let's go ahead and walk through the following steps of the grant proposal process. We're going to start with project summary and then move on to evidence of need, goals, implementation, timeline, evaluation plan, promotion, continuity and sustainability, and lastly, we're going to look at budget. For project summary, the emphasis is going to be on need, focus, audience, and outcome. And a lot of the work you did earlier pertaining to the needs assessment will come in handy once you begin working on this portion. And the more questions you asked and the more information you gathered during those initial phases, again, will be very helpful here. So after asking ourselves the questions we looked at previously, we landed on the following for our need, focus, audience, and outcome. So for need, we wanted to increase library awareness. For our focus, we wanted to focus on the different resources and services offered by the library that folks might not know about. For audience, we wanted to reach out hospital-wide with an emphasis on off-site clinics. And for outcome, we wanted to help support the QI initiatives and patient care provided to the county's most vulnerable and underrepresented populations. So based on each of those pieces, the opening statement for our project summary resulted in the following. In alignment with the goals of the National Library of Medicine, the Powering Clinics and Communities with PubMed, Building Library Awareness at a Safety Net Hospital System project, seeks to build awareness at JPS Health Network offsite clinics around the resources and services offered by JPS Medical Library to further support patient care provided to Tarrant County's most vulnerable, underrepresented populations. So moving on to the next section, which is evidence of need. Here, the emphasis is going to be on background information for your library or institution, information and demographics for the communities that you serve, information about the geographic area where services are provided, and also any challenges that are unique to the area and population. There were some excellent resources created by the hospital network that we were able to pull from to demonstrate evidence of need. We pulled information from some other resources as well. And one of those resources that was very helpful was Texas Health Maps, which shows life expectancy by zip code in Texas. And as you can see from the map displayed here, we were able to include information from this resource, which shows the 76104 zip code area has the shortest life expectancy in the state of Texas. And this is where the main campus of the health system is located. So including additional bits of information like this are very helpful for the evidence of need portion. Moving on to the goals section, we recommend aiming for 2 to 3 realistic goals that can be completed in the grant timeframe, aligning those goals with NNLM goals, and also including broad steps to support how the goals will be completed. So let's look at an example of this. So here is one of our project goals and objectives. So starting with the project goal, which is to increase awareness of JPS Medical Library resources and services through training sessions via Zoom for offsite JPS Health Network clinic staff, One of the objectives of this project goal is to provide information about services available to JPS Health Network staff, focusing on key services such as literature search assistance and interlibrary loan, and thinking about how the project goal aligns with NNLM goals. In this case, it aligns with the following: work through libraries and other members to support a highly trained workforce for biomedical and health information resources and data. So again, when you're going through that goals portion, it's just helpful to keep in mind your project goals as well as the alignment of those goals with NNLM goals. For implementation, the emphasis is on considering if the project will be implemented in one stage or multiple stages. And if there are multiple stages, what will those stages be? So for our project, the stages were material creation, design and printing, distribution of materials, training sessions, and evaluation. Moving on to timeline, here the emphasis is going to be on determining who is responsible for each part of the project, and also when is each part of the project due, and can each person complete their part on time given current workload, obligations, and so on. And also thinking about which other groups will be involved and how much time do they need to complete their parts. So some additional tips to think about for project timeline are keeping the schedule somewhat flexible, allowing for some padding to account for possible delays and staffing changes. So we did have some staffing changes during our implementation period. So putting in that extra time cushion for each phase turned out to be very helpful for us. Also considering the schedules of other groups that you need to partner with, such as IT, marketing, and external vendors. And getting in touch with these groups while you are working on the grant paperwork to get a sense of when they might be available and how long it might take them to complete any needed project deliverables. Moving on to the evaluation plan, here the emphasis is going to be on determining which project criteria are measurable and how will this data be collected, when will the data be collected, and how will the data be reviewed? Also, consider if you want to focus on gathering qualitative or quantitative data or both. With qualitative data, we are looking at those non-numerical data elements, such as comments and open-ended survey questions, for example. And with quantitative data, we are looking at that numerical data like number of participants, number of classes, and responses to Likert scale questions, for example. Moving on to the promotion section, the emphasis here is on how you will tell people about the project. So consider which tools provide the most reach for your institution. And is it going to be things like direct outreach and communication, website promotion or social media promotion, print materials such as flyers? Also think about if there is a particular subset of your community that you're trying to reach, then what is the best way to reach them? So for example, if you're trying to reach retired community members, then possibly things like print materials or mailers might be more impactful than social media. looking at continuity and sustainability, here the emphasis is going to be on the quality of materials. So making sure that we are using the grant funds to purchase good quality materials that will last. It can be tempting to purchase cheaper materials just to get larger quantities, but that material quality is very important. And when possible, try to get samples of any materials that you plan to order and purchase. For distribution of materials, thinking about who is receiving the materials, how are they receiving the materials, and also when will they be receiving the materials. And thinking about plans for storing digital copies when applicable so that any materials can continue to be updated in the future. And this might also include submitting materials to an institutional repository if there is one available at your institution. So the materials are findable by people outside of your organization. Lastly, looking at the budget portion, the focus here is going to be on things like publication costs and costs of materials and supplies. So do your best to be as specific as possible when it comes to budget. You don't want to worry about not having enough money to complete your project or coming in way under budget. And also, don't forget to account for smaller costs like shipping costs and also costs of shipping materials, things like stamps and envelopes and boxes, for example. Another thing to think about is there are some items that cannot be covered by NNLM grant funds. So it is important to make note of those items. And if any of those items are needed, give yourself plenty of time to explore other options through your library or institution for purchasing those items. So after submitting the grant paperwork and receiving that acceptance notification, next, let's go ahead and look at additional steps for implementing the project. And as I mentioned earlier, we developed our project in 4 phases: designing materials, distributing materials, scheduling training, and evaluating training. For the designing materials phase, we decided to create the following. We created an NLM resources flyer, which would be placed in a library branded notebook, a library care package workbook, and a Power Up with PubMed branded solar powered charger. The purpose of the NLM resources flyer was to provide information on how to connect to library resources with a focus on PubMed, since PubMed is the easiest way for our users to connect to our full text holdings. We also wanted to highlight a recent website redesign that we had just completed. So here you can see that we migrated to a more modern, user-friendly design, which highlights PubMed in the tabbed search box at the top of the homepage. On our previous website, PubMed was more difficult to locate. And when we conducted usability testing as part of our redesign project, participants noted they had difficulty locating PubMed on the homepage because it was competing with too many other elements. So the front of the NLM resources flyer, which is 5x7, includes a graphic of the redesigned library website, again, which showcases PubMed there at the top in the tabbed search box. And it also includes a QR code that users can scan to access the website and get to PubMed. Underneath the graphic are two information boxes. And this is information that we share frequently with our users. The first box reads, "Start your research from the library website at jps.unthsc.edu." And we share this information often to remind users that they need to start their research from the library website in order to access all of the subscription resources that we provide. The second box reads, "Access thousands of resources on or off site from any device." And we share this information often as well to remind our users that regardless of where they are, they can access all library resources by going directly to our website link. Underneath those boxes is our contact information, which includes website address, phone number, and our email address. On the back of the flyer, we feature additional NLM resources along with comprehensive resource descriptions for clinicaltrials.gov, Medline Plus, and LactMed. And information about the grant project is also included on the back of the flyer. The notebook is a standard black spiral notebook, which is sized 5.25 by 7.25 inches. It includes a graphic element for the medical library on the cover, along with the medical library website address. And the flyer fits inside the notebook, which makes it easy for us to distribute. The next item, which is the Library Care Package Workbook, is an 8.5 by 11 spiral notebook, and it features information about the services and resources that we highlight in our traditional classes. It also walks users through the process of creating a PICO question and developing a search strategy. So let's look at some of the pages in the library services and resources section. The Search Biomedical Databases page points users to our key biomedical databases, such as PubMed, of course, PsycInfo and PsycArticles, CINAHL Complete, Medline Complete, and Global Health. The Find Full Text Articles page walks users through the steps of finding and requesting full text articles from PubMed and our other resources. The Browse eJournal Titles page highlights a tool we provide access to called Browsing, and it walks users through the steps of downloading Browsing, creating bookshelves of their favorite eJournal titles, and setting up alerts to be notified when new articles are published in those journals. The Access eBooks and Text page highlights some of our key ebook databases and provides resource descriptions for Access Medicine, Clinical Key, Oxford Clinical Psychology, and Psychiatry Online. The workbook also contains a section on literature searching, starting with a page on quick tips for literature searching, which outlines the following 5 tips. Create a PICO question, list keyword variations, connect search terms, choose 2 to 3 databases, and try your search. We outline the 5 steps, starting with the following scenario. You have several adult patients with hypertension and want to improve medication adherence. You wonder if patient education will help. So from this scenario, the elements of a PICO or PICOT question are identified. And underneath the scenario, step 1 begins with the process of creating the PICOT question, showing how to arrange the different elements using the framework. So our PICO question is, in adult patients with hypertension, does patient education compared to no patient education improve medication adherence over 3 months? And the next few pages move through steps 2 through 5, and they show how to identify key concepts of the PICOT question and create a list of keyword variations, connect search terms together using Boolean operators and, or, and not, choosing 2 to 3 databases to search. And here we also include some of our favorite databases, which are PubMed, CINAHL Complete, and PsycInfo and PsycArticles. And lastly, try your search, which provides an example of a search strategy complete with Boolean operators and similar terms grouped together with parentheses. The Power Up with PubMed's solar-powered charger was conceptualized as a tool for providers on the go to easily charge their devices and remind them to connect to PubMed through the library website in order to access full text articles and request any articles not available in our collections. The chargers are black and include a graphic element for the medical library on the front, along with our website address. In the second phase of the project, we distributed the materials. Materials were boxed up and either dropped off or mailed to offsite clinics. And in addition to the materials, we also included a thank you card for the providers, just to thank them for the amazing work that they do. And also, of course, included additional information on how they could get in touch with us. For phase 3, we created a shorter version of our typical library resources and services class at 30 minutes long. And 3 sessions were scheduled and delivered via Zoom during lunchtime so that we could make the classes as accessible as possible. The 30-minute classes essentially covered the same content that is included in the workbook, and classes were delivered using the Kahoot platform so that we could incorporate questions, puzzles, and other interactive elements. So here you see an example of one of the Kahoot quiz questions that we included. And the question is, which framework is commonly used to develop clinical questions related to therapy or intervention? And of course, the answer is PICO or PICOT, but they also have options for PO, Spider, and Spice. For evaluation, we created a Qualtrics survey to administer to training participants in order to evaluate the effectiveness of the training content and materials. And the survey included questions to gather both qualitative and quantitative data. So many valuable insights were gained throughout the grant process. And let's go ahead and take a look at some of the areas for improvement that we identified, as well as some of the project strengths. So some of the areas of improvement that we noted during the grant process were a small number of participants in the training sessions. Finding the best days and times to deliver online courses can be tricky since schedules vary so much, but that is an area that we will continue to explore moving forward. We also didn't receive any feedback via the survey. We do, however, have a quick item at the end of all of our online courses to gather very informal feedback about the participants' experience. And that has worked very well for us, but we will continue to explore ways that we can increase survey feedback. Some of the project strengths were that we received very positive feedback informally regarding the classes and the materials. So things like comments and notes through email that we received. We were able to build some really wonderful new partnerships, both internally and externally. And going through this process was really helpful for library staff. We were able to increase skills and knowledge by working on this project. And we now have a really strong set of outreach materials that we are very proud of as a result of this project. So wrapping up, please don't hesitate to get in touch anytime for more information. I can be reached at brandy.klug@unthsc.edu. And before we move on to questions, I would like to just give a few shout outs. So in addition to a big thanks to NNLM Region 3, I'd also like to thank the following folks for their project contributions and support. And this includes Lewis Library staff, past and present, Brooke Amon, Lorraine Sheldon, and Michelle Whitehead. And our amazing hospital library staff who have supported this project and just do fantastic work every day. Kelly Brown, Ravenhill, and Colin Jones. And with that, I really appreciate your time today. Thank you so much for having me, and I'm happy to take any questions you have.
Thanks so much, Brandy. It's so nice to be able to see this presentation. I was the grant liaison with Brandy and JPS, and it's so nice. I knew a lot about it, but to see the final product and hear about the process is really great. So yeah, if anybody has any questions, you can use the Q&A. Oh, I do have a question, and maybe how many people, do you get a lot of feedback from your users or the people out in the field, or anything that they, like we always ask, are there things to add or questions from the people that you've provided this tool for?
Yes, so we have received some follow-up questions and notes from folks that we did distribute the tools to. Absolutely. So and it was informal feedback, but we were really happy to hear from those that did have an opportunity to get in touch. And the response that we did get was very positive.
That's great. Appreciate that. So do you have any plans then to, kind of expand this to a bigger audience, or because it's such a great tool? I mean, I can see this really working for a lot of people. Maybe it'd be a good MLA presentation.
Oh, thank you, Margie. I appreciate that. And thank you as well for being such an outstanding liaison for us. We really do appreciate it. I think there could definitely be some plans to expand in the future and kind of think about that. We have an amazing new staff member in my former position. So our new clinical engagement librarian is doing amazing work with these groups. So looking forward, we'll continue to think about how we can kind of expand and grow on this.
That's great. I appreciate that. Does anybody else have any questions out there for Brandy? Okay. Well, if that's the case, go ahead and you can stop your sharing. I'm gonna thank you so very much, for this presentation, and I mean, our grants are open now, and so I hope that you all can take this information and use it to explore some of the links that Brandy gave you to the opportunities that we have open. And again, all of our staff were really willing to discuss and talk to people about potential projects and all of the things that they would like to propose. So without further ado, then I'll thank Brandy, and please, we're going to do a few more things after we conclude here. But next month we have Health Bytes back on the usual second week of January, and I thank you so much, Brandy.
Yes, thank you so much. I really appreciate it.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.